Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. Today's focus is on NCLEX questions and the process behind them. You can find me on social media, Instagram, Facebook, Pinterest, Nursing KAMP. Today's tip we're going to talk about is delegation. And delegation is important because when you have to delegate in an NCLEX style question, you do not delegate admissions to anyone. Don't delegate admissions, transfers, in or out, and education. Anything that a patient will need to be educated on. And this is an important point, especially for nurses. If you have a maternity nurse that's used to taking care of babies, not supposed to be a baby, we'll put the baby in there. Hey. And they come down to a heart floor where they're expected to take care of patients who might be on rhythms. They're going to take care of mostly medical, surgical patients only. And they can't handle admissions. So if a patient's being admitted with cardiogenic shock, they can't handle that. Or a patient's admitted post-CABG, they can't handle that either. So they always have to be handling medical, surgical patients, which they might take care of on any kind of floor. So they will also not take care of transfers. Transfers in from another floor, from a med-surg floor to a cardiac floor, or transfers out, because they couldn't answer the questions most likely. It doesn't mean that they might not be able to. But as far as the NCLEX is concerned, they'll only take care of med-surg patients, and they'll not educate on cardiac patients. Okay. First question. Oh, there we go. The client is receiving thrombolytics and therapy with continuous infusion of streptase. The client suddenly becomes extremely anxious. And complains of itching. Well, what's going on? They have a continuous infusion. They're feeling anxious and itching. This sounds acute. All right, the nurse hears stridor. In case I missed that it was acute, hey, you got stridor. Well, what's stridor? Closing airway. Airway problems, too. In case I missed this, on examination, the client notes generalized urticaria and hypotension. Holy crap. All this stuff is going on. This is an acute question. Thrombolytic therapies, what's that? Bleeding. There's bleeding problems. What's streptase? Well, on Nursing KAMP, I have a sticky note on this streptokinase and adipase, and it's responsible for bleeding. You can see that at Nursing KAMP or on Pinterest or on Instagram. But let's get back to the question. Which of the following should be priority action? Okay, action, need to do something. Best, most, first, priority action. Action means I need to do something, so let's go through it. Administer oxygen and protamine sulfate. Okay, so there's implementation. Next one, stop the infusion, call the doctor. Okay, stop. Okay, that's an implementation. Cut the infusion rate in half. Okay, well, what does that mean? What do you mean half? What was it before? Don't know. So that can't be correct. And sit the client up in bed. Well, what do you mean sit him up? Do you mean sit him like this, high phallus? Do I mean semi-phallus? What does that mean? Again, very vague. So I'm going to get rid of that one right away. Administer Benadryl. Slow down. How much Benadryl? Okay. Is it IV? Is it PO? Well, it's not really clear. It's very vague. And NCLEX is never going to ask you to administer a med, generally. It's what are you going to do, nurse, now? What are you going to do? And we talked about this in the previous one. Here and now. This is supposed to say set 2. Sorry about that. Okay, so it can't be this because I'm not going to administer a medication and continue infusion. Well, there's a problem going on. I'm not going to continue this situation because this patient's potentially bleeding in front of me. So I'm not going to continue with that. So I'm going to get rid of that one too. So I'm down to 2. I have stop the infusion or administer oxygen and protamine sulfate. Okay, well, there's a problem with this transfusion because the patient's anxious. There's some sort of reaction going on. Okay, if I give them oxygen, what's the outcome? Is the transfusion running? Yes, it's still running. That would make it acute. And that would still make that, I'm not really treating the problem. It's a Band-Aid, literally. And protamine sulfate, that's for heparin, not for strep days. So I'm going to get rid of that. And that gives me the end result. Stop the transfusion, call the doctor. Well, immediately I stop because that treats the now. Because there's a problem with this infusion. And in case I didn't miss that, there was a lot of data in here that said there's a problem. Okay. Let's move on. Credited answer was 2. Moving on. Next question. Okay, the next question. A client's diagnosed with an acute MI and receiving TPA AWHALES. All right, activates. Again, from a sticky note that's on my website and also on Pinterest, free. You can pick it up there and download it and study for your nursing. All right, let's get into it. All right, so a client's diagnosed. All right, so that's important because diagnosed means that assessment has been pretty much done, okay, because they're diagnosed with it. Acute MI, well, which one? Is it a right-sided MI? Is it a left-sided MI? Is it inferior, posterior? It's very vague. So it's an MI question, receiving TPA. Okay, well, what is this? It's for bleeding. So they're at risk for bleeding. I know that because that's a bleeding medication. Which of the following is a priority nursing intervention? Okay, nursing intervention. So let's go. So nursing intervention means I need to do something. Okay, but nursing priority states that I assess first before I implement. There is no symptoms here for this patient, right? So there's nothing going on of bleeding. So I'm going to be assessing for bleeding because AWHALES, it causes bleeding. And it's given during an MI so that it can, so the body doesn't, so the cardiac tissue doesn't cause further damage. Okay, monitor renal failure. All right, well, what does that mean? Monitor labs, like my BUN and creatinine. And what do you mean renal failure? Is this acute renal failure? Is this post-renal failure? Intrarenal failure. See my intrarenal failure, acute renal failure video on that. So that's very vague, right? So I'm going to get rid of that one. Next one, monitor psychosocial status. Well, psychosocial, psych, in a priority question, and this makes it a priority question because AWHALES is acute. It's an acute med, right? So because of risk of bleeding. So psychosocial, monitor psychosocial. Like, how are you doing today? What's going on? Are you feeling okay? It's not priority. It's not a priority action. It's very vague of what's going on. So we're going to get rid of that one as well. The next one. Monitor for signs of, well, geez, I've been talking about bleeding this whole time. There it is. But you've noticed I just don't go right down and look for the answer. Nursing NCLEX questions are all about process. It's not hunting for the answer, going right down and saying, oh, where's the answer? Where's the answer? Hopefully it's going to stick in. No. It's assessment before implementation. Unless the patient is in distress, then it's usually implementation. But we'll cover that more when we get to priority questions. So never ever hunt for the answer. Take each one effectively. So I know bleeding's probably the answer, but I'm going to go to the next one. Have heparin sodium available. So, okay, so I'm going to have more bleeding meds available? Well, the problem is bleeding. Why would I have more bleeding meds? Well, maybe if this medication's not working, the treatment in the future will be bleeding. But that doesn't make any sense. So the credited answer is 3. My name is Kamp, and this is Nursing KAMP, and this is NCLEX KAMP, where I'm covering nursing questions to help you in school. I can be found on Instagram, Facebook, Pinterest, and Etsy, as well as nursingkamp.com. That's all for me today. Nurse on, and we'll see you next time.